Well, Dr. Nathan, it's really nice to connect with you. I have heard your name numerous times across a multitude of podcasts that I listen to, and I'm really excited to talk about all things nitric oxide today because
Me too.
this is what you could call a pretty hot topic, right? Over the past few years, it's definitely something I don't know too much about, so I'm excited to learn more, and it's something that I have yet to dedicate an episode to. So I'm truly
Well,
honored to have
thanks
you
for
be the first
considering me.
person to talk about it.
Yeah, of course.
Awesome. So with that, Dr. Nathan, let's just kick things off. Let's get right into it. I've heard you describe nitric oxide as this holy grail molecule. Can you please share with us why that is?
Well, again, thanks for having me. Great to be with you. But yeah, nitric oxide is what we consider the holy grail, and it's just not a quote from me. I think Louis Ignarro made that statement back in 1998 when he won the Nobel Prize for the discovery of nitric oxide. So nitric oxide controls and regulates everything we know about the etiology and the mechanism of the onset and development of cardiovascular disease. And it's not just cardiovascular disease, it's really every age-related chronic disease. So the holy grail means that it's affecting fundamentally the whole process of disease progression. And when we look at different diseases and different organ systems, there's really 4 to 5 fundamental hallmarks. There's always low blood flow to the affected organ, right? Like in heart disease, you got an obstruction of the coronary arteries, so there's decreased blood flow. In the brain, there's loss of regulation, so there's focal ischemia and Alzheimer's and dementia and Parkinson's. And so blood flow is a problem. And then the other thing is that the tissue's inflamed. There's inflammation, there's immune dysfunction, and there's oxidative stress. And then in many other conditions, there's insulin resistance. We see that in diabetes and metabolic disease and Alzheimer's. And so the fact that nitric oxide affects and corrects all those 4 to 5 fundamental hallmarks of chronic disease really makes it the holy grail. Because nitric oxide is a vasodilator, so it's opening up the blood vessels and now perfusing and perfusing those tissues with oxygen and nutrients. It decreases inflammation. Nitric oxide is one of the most anti-inflammatory molecules that the human body produces.
Wow.
It prevents oxidative stress. It mitigates the immune dysfunction. And then we published, I think, in 2009, 2010, that nitric oxide is part of insulin signaling and glucose uptake. So simply by giving nitric oxide or correcting nitric oxide deficiency, restoring natural production of nitric oxide, we address the fundamentals of all chronic disease.
Wow. So fascinating. The first question that comes to mind, Dr. Nathan, is how does one actually measure nitric oxide?
Yeah, look, that's been a challenge in translation into clinical medicine for the past 30 years because people need to understand nitric oxide's a gas. And once it's produced, it's gone in less than a second. So in the research environment, we can kind of create a fingerprint of nanobiology and pick up metabolites and figure out when nitric oxide's produced, where does it go, what does it become. But in clinical medicine, that's not the case because it's not like, for example, vitamin D. We can draw blood, we get a number of your vitamin D, and then we treat and we titrate dosing to reach optimal levels. So with nitric oxide, we can't do that. There's no metabolite in the blood that we can quantify and give us a determination of what your nitric oxide status is. There are some medical devices, some functional devices that look at endothelial function. And those are very, reliable, accurate, and really important devices, but very few clinics and physicians use it. But it's measuring what's called flow-mediated dilatation and the ability of the endothelial cells to produce nitric oxide. So what we have to do is we rely on symptoms. We can't measure it. We can detect it, but it's not used a lot in clinical practice. So we rely on symptoms. So if you have erectile dysfunction, that's a symptom of nitric oxide deficiency. Because if you can't make nitric oxide to dilate the blood vessels of the sex organs, you don't get the engorgement. We develop sexual dysfunction in both men and women. So that's number one. Number two, if your blood pressure starts to go above 120/80, then that tells us that your body's not making enough nitric oxide.
Interesting.
If you make nitric oxide, it dilates the blood vessels. So now you have a finite volume of blood that goes through more dilated blood vessels. So pressure goes down. If you can't make nitric oxide, now the blood vessels are constricted, and now you're pushing that same volume of blood through smaller pipes. And basic physics tells us that pressure goes up. And 2 out of 3 Americans have an unsafe elevation in blood pressure. So it's a major problem.
That's
Then,
wild.
number 3, you start to develop metabolic disease because, as I mentioned, nitric oxide is part of the insulin signaling and glucose uptake, clearing sugar and clearing glucose from the circulation. If you can't make nitric oxide, you develop insulin resistance, type 2 diabetes. 9 out of 10 Americans are metabolically unfit. Huge problem. Number 4, you start to develop exercise intolerance. And so people can't maintain an exercise regimen without getting short of breath, chest tightening. And then 5th, people develop dementia and Alzheimer. And that's kind of the terminal step in lack of nitric oxide. And so you have to listen to your body. Our body talks to us all the time. If you have sexual dysfunction, there's a reason. Find the answers. If you have metabolic disease, there's a reason. And maybe nitric oxide is the answer and the solution. I believe it is, and I think it's based on not just basic science data, but translation of that into clinical medicine.
That's fascinating. Going back to the testing, so in terms of like those saliva test strips at home, like the nitric oxide test strips, would you say those aren't necessarily that accurate?
Yeah, I'm the one who developed those back in 2010. I was the first one to create that point of care non-invasive diagnostic. And the reason for that was because people ask the same question you ask. How do I know if I'm nitric oxide deficient? And how do I know if I need to consider nitric oxide repletion or, mitigate a lot of the symptoms that arise from that? And so understanding how the body recycles nitric oxide production, the role of the oral microbiome, I developed these salivary test strips. And, this was when I was a professor of medicine at UT Medical School in Houston, and we filed patents through the university. And this was based on old chemistry. So there's nothing new and novel about the chemistry that I'd put on the end of these test strips, but we thought it would have some diagnostic utility and offer some value. But what we found was once I abandoned the patents on those, then other companies started manufacturing these test strips. And now you can find them
Not
from
surprised.
companies. Yeah. But no, I think they have some utility. But, you have to understand what you're measuring. And not only that, you have to understand what you're measuring and what it means and how to make a kind of a diagnosis. And so the problem I had with those, and the reason I don't use them anymore, is because what we're picking up in the saliva is not always reflective of what's happening systemically. And the best example came, and this is what opened my eyes to it, was that you have people that are clinically nitric oxide deficient. And this came from a 50-year-old man we were trying to figure out. He had a high blood pressure, he was diabetic, he had severe erectile dysfunction, and he was short of breath, and he was developing brain fog. So those are all the clinical kind of presentations of nitric oxide deficiency. So we go, oh, look, well, take this test strip and let's measure your levels. And he lit it up like a Christmas tree, in fact, to the levels that said optimal.
Wow.
And so I'm thinking, I go, well, how can this be? This can't be. And then through understanding what we're measuring and what it means, we did a full oral exam and a perio exam, and we found out that this guy had severe oral dysbiosis and severe oral infections. So what we were measuring in the saliva was reflective of a local immune response in the mouth that was completely disconnected to what was happening systemically. So those are false positives. So then I got away from using those because I think it could mislead and misguide, therapy or give people a false sense of security. And they go, oh, well, I don't need nitric oxide because I'm lighting this up. I'm using your own test. You're telling me that I'm optimal. And so that created a problem. And I don't use those anymore.
Interesting. See, perfect person to ask them. I'm glad I asked that question. I have yet to use them. I've heard a lot of folks talking about them.
It's a good conversation starter because there are no false negatives. So if you have a normal patient population and they apply some saliva to the test strip and it shows that they're low, they're low. I mean, that's true. Now, what it doesn't tell us is, why are you nitric oxide deficient? Is it because of your diet? Is it because you're using fluoride? Is it because you're using antiseptic mouthwash? Is it because you can't make stomach acid? Are you taking antacids? Is it because you're just unhealthy and have endothelial dysfunction? So then until you know that, it's hard to intervene and guide these patients on what the best solution is for their individual condition.
Right. So many different contributing factors. But with that, Dr. Nathan, I'd love to start with the oral microbiome. And you already mentioned it, but, the pervasive use of fluoride, mouthwash. These are all things that folks, I think, do in an attempt to benefit their oral health, but it really is actually doing the opposite. And can you just touch on the relationship between our oral microbiome and our ability to produce nitric oxide?
Sure. Well, let's go back 100 years, because I think we have to understand what led us to this point, and then that gives us kind of the guidance on how do we correct the path and right the ship. Over 100 years ago, it was first recognized that oral pathogens were causing systemic disease. And that's why when you go to your dentist and you've got bleeding gums, upon probing, there's translocation of oral bacteria into the bloodstream, and it causes systemic inflammation and increases the risk of heart attack and stroke. So back then, 100 years ago, they thought, well, let's give an antiseptic, an antibiotic in the mouth, kill all the bacteria, and then we can mitigate the translocation and the increased risk of heart attack and stroke. And that's called the oral systemic link. But that was long before it was ever recognized that there are bacteria that live in and on our body that outnumber our human cells 10 to 1. So today we know that the microbiome is extremely important for systemic health, right? And just like no one would take an antibiotic, an oral antibiotic, every day for the rest of their life, because we now know it causes systemic disease. So similarly, you shouldn't take an antiseptic mouthwash or be exposed to fluoride every day to destroy the oral microbiome, because now we know it's causing systemic disease. So now go back 20, 25 years, it was first recognized that there are bacteria on the crypts of the tongue that are what we call nitrate reducers. They're taking nitrate that's found in green leafy vegetables and converting that and metabolizing it into nitrite and nitric oxide. And humans don't have the capability to do this. We do not have the gene to do this metabolism. So we're 100% dependent upon the bacteria, specifically the bacteria that live in the mouth. So if you're doing things to destroy these bacteria, such as drinking fluorinated water, which is in our municipal water supply, using fluoride in your toothpaste, or using an antiseptic mouthwash like Listerine, Scope, chlorhexidine to completely eradicate the oral bacteria, and you see the commercials, you see it kills 99.9% of the bacteria in your mouth. That is a true statement, but it's not a healthy statement. I mean, you should avoid it because of that.
Right.
So we published, and several other groups published, that if you use mouthwash, it kills the microbiome, it shuts down nitric oxide production, and we can see an increase in blood pressure. And
That's
that
wild.
is transformative. It's paradigm shifting, because high blood pressure is the number one risk factor for the number one killer of men and women worldwide, which is cardiovascular disease. So if we can figure out how to normalize blood pressure, we can begin to impact the onset and progression of cardiovascular disease. And that's huge, because no one's ever considered this before.
Right. So fascinating. Going back to mouthwash, though, Dr. Nathan, would you define an antiseptic mouthwash as anything that contains alcohol? Because I know Listerine does have an alcohol-free mouthwash line. I'm a huge fan of, again, natural alternatives. There's a brand called Vriswell that uses hydroxyapatite in their toothpaste instead of fluoride to help, remineralize teeth and build tooth enamel. I'm sure you've heard of it.
Yep.
I like to do oil pulling. That's kind of my quote unquote alternative for using mouthwash. But there are a lot of natural mouthwashes out there too. So I guess my question for you is like, what should listeners be avoiding? Is it just mouthwash containing alcohol, or are these other natural alternatives also not great?
Well, we've learned a lot, but there's still a lot we don't know. So I'll tell you what we know and kind of where we're headed. So anything that says antiseptic, alcohol-based mouthwash are antiseptic, and they should be avoided. But even the non-alcohol mouth rinses have chemical antibiotics, chemical antibacterial substances. Chlorhexidine isn't a mouthwash base, but it's a chemical antibacterial. They use it for surgical scrubs to clean the skin before surgery and making an incision on the skin to kind of sanitize the skin. So we know that anything that says antiseptic, antibacterial is not good and should be avoided. But here's what we don't know. We don't know the effects of, like natural, essential oils and oil.
Right.
I think we've done some initial testing, and oil pulling doesn't seem to destroy the bacteria. We just don't know what it's doing to the diversity of the microbiome. And same thing with with these other so-called natural alternatives. But here's what
Right.
we've been focused on for the past 4 to 5 years, because this is a major problem. Almost all toothpaste have fluoride in it, and 2 out of 3 Americans use antiseptic mouthwash every day. So what I've been working on for the past 4 to 5 years is how do we develop a toothpaste, a fluoride-free toothpaste that, number one, can still remineralize teeth, prevent cavities and caries, kills the oral pathogens, but doesn't destroy the non-pathogenic commensal bacteria that's responsible for nitric oxide production. And we finally solved that. And I've got a toothpaste that we're launching mid-March. So in about a month or 6 weeks, we'll have a nitric oxide friendly toothpaste
Wow.
on the market that's going to restore the oral microbiome, preserve oral health, and eliminate fluoride. And then we've
That's
also been
awesome.
working on a mouth rinse because, a lot of people, most people want to have a fresh breath. They want to feel the cleanliness of their mouth. And so I've developed a mouth rinse that's going to normalize and optimize salivary pH. It's selectively killing the pathogens, and it's enhancing the diversity of the oral microbiome. So I'm not a big mouth rinse fan. I've never used mouthwash, but there are those out there that do and that need it because they've got periodontal disease, that have gingivitis, and they have, these oral pathogens are diagnosed and they need to address them.
Right.
So I think for those 2 out of 3 Americans that use it, and then those dentists that use it clinically in their patients because they need it, then we're going to provide a safe alternative to the, putting an atomic bomb in your mouth and just killing it.
Right. Very exciting. No, that's awesome. I'm excited to try it. One last question on that. What are your thoughts on hydroxyapatite? Has that been shown to limit or impede on nitric oxide production?
No, in fact, we're putting that in our toothpaste because the data on hydroxyapatite are really pretty fascinating. It
Right.
remineralizes the teeth. We put electrolytes in our toothpaste, and we're creating a buffer to maintain normal salivary pH, because once your saliva gets acidic, it completely changes the microbiome, and then
Right.
it establishes an environment for these caries causing bacteria to set in, and you get cavities. So maintaining optimal salivary pH is absolutely critical. So we're addressing the fundamentals of oral health and microbiome biology. And I think this toothpaste and mouth rinse are going to change dental medicine and really start to impact public health.
That's awesome. Very exciting. One other question too for you, Dr. Nathan. Has there been any research? Our bodies are incredibly resilient, right? So I'm curious, what research, if any, has there been that shows that, I guess, upon stopping the use of alcohol-based mouthwashes and fluoride, does the oral microbiome actually repopulate?
Yeah, we
Like, how
published
long
on
does
that
that take?
we published on that in 2019. And what we found was it was in 4 days of stopping antiseptic mouthwash, the oral microbiome completely repopulates. It,
Wow.
you increase the diversity. So it's not one of these things that takes time. So, the time is now. So if you're using mouthwash and fluoride in your toothpaste, stop immediately.
Right.
And within 4 days, the microbiome is, as you said, really resilient, and it repopulates, it reforms these biofilms, and it maintains that ecology, provided you're optimizing the environment, maintaining
Right.
normal salivary pH, keeping it a little bit basic instead of acidic, and then, feeding those bacteria good probiotics and prebiotics, and eating a balanced diet in moderation with
Right.
very little sugar. Because
Interesting.
sugar is a toxin.
Yeah, that's a whole other conversation. We'll have you back on just to discuss that.
Oh, yeah.
But 4 days, that's wild. What about our actual gut microbiomes? Has there been research that shows like how long that takes to, I guess, repopulate or get back to homeostasis after like a series of antibiotics?
We haven't really studied the gut microbiome in terms of nitric oxide. There's enormous amount of research. I mean, everybody was focused on the gut microbiome 20 years ago, and we just went a little bit upstream and started where it all begins, in the mouth, and focusing on the oral microbiome. But I think if you look at the data, in some cases we need an antibiotic, an oral antibiotic, if we've got an infection. And I'm not against that. But I think you have to stick to that regimen of 7 to 10 days to
Right.
kill the infection. But then you've got to take action and take steps to restore, because those antibiotics kill the pathogens, they kill the commensal microbiome, and it causes enormous dysbiosis. But I think
Yeah.
what we're finding, and I think what the scientific literature will tell us, that it takes 10 days, 2 weeks. Once you stop the antibiotics, and it depends upon the class of antibiotics, what their clearance rate is, what their pharmacokinetics and pharmacodynamics are, to clear that
Mhm.
from the system and then allow for those bacteria, the good bacteria, to repopulate.
Right. So interesting. You may have heard of this, Dr. Nathan, too, but the protocol back, I don't know, 20 or so years ago, for me at least, I was diagnosed with mitral valve prolapse. And the protocol was to take antibiotics prior to every dental cleaning to prevent, bacteria from potentially reaching the heart. And now obviously that has changed, but I just recall swallowing these like 4 horse pills every time I would see the dentist twice a year. And I think back and I'm like, that probably wasn't the best for my, gut health. But, hindsight's 2020, we live and learn. But it's interesting to see how, that has certainly evolved and the protocols have changed over the years.
Well, I know, medicine is risk management, and
Right.
there's certainly risk in people with heart valve disease, where if there's translocation of bacteria, they can harbor on that and really
Right.
lead to heart failure, and they eat that tissue, and these
Right.
bacteria just destroy that tissue. So I think and everybody's different, right? We have to manage the risk, we have to mitigate the risk the best way possible. But yeah, I think that was done with reason, but I think there's better ways today than just, again, antibiotics
Yeah.
and antiseptics are atomic bombs that kill everything. And now we've learned enough to where we can be selective. So, we can be a sniper instead of a shotgun blast, and really
Right.
collectively take out the pathogens.
Yeah. And again, it's acute situations, or rather acute doses, are certainly different than a more long-term
Sure.
daily consumption of that, for sure. So going back to lifestyle strategies, so certainly stopping our use of fluoride and mouthwash is one. What are some other lifestyle strategies that we can incorporate on a daily basis to help optimize our nitric oxide production?
Well, it's really simple. I tell people you only have to do 2 things. You have to stop doing the things that we know disrupt nitric oxide production, and then start doing things that promote it. So we've addressed getting rid of fluoride, stop using antiseptic mouthwash. And the other big thing to stop are antacids. Antacids
Mm.
are some of the most dangerous drugs on the market. These drugs, people have been on them for 3 to 5 years, have a 40% higher incidence of heart attack, stroke, and Alzheimer's. So
Wow.
inhibiting stomach acid production as a biochemist and physiologist is the absolute worst thing you can do for human health. And they're completely shutting down nitric oxide production. So if you're on antacids, you have to talk to your provider, your prescriber, or if you're taking them over the counter, you have to eventually wean off of these because they're dangerous and they're causing death and destruction and chronic disease. So once you get rid of antacids, mouthwash, and fluoride, now your body is actually primed to produce nitric oxide on its own, which is what we want to do. And now, how do we encourage that? Well, it's moderate physical exercise. 20, 30 minutes of moderate exercise a day, or 3 to 5 minutes of high intensity interval training, has been shown
Hmm.
to enhance nitric oxide production, stimulate it, and you get the benefits of that. The other thing is deep breathing, nasal breathing. If you got mouth breathers out there, they're bypassing this nitric oxide production pathway, and it's leading to nitric oxide deficiency. And then
Hmm.
the other big thing is a balanced diet in moderation, throwing in some more green leafy vegetables, a complete avoidance of sugar and sugar laden supplements, because sugar is a toxin. It's an addictive substance. It sticks to proteins and enzymes and prevents them from doing their job. And it completely changes the microbiome. And then the other big thing is just 20, 30 minutes of direct sunlight a day. And
Hmm.
there's certain frequencies and wavelengths of light that can activate nitric oxide production, release nitric oxide from these photolabile stores. So it's really all the things that we know that have stood the test of time that are health promoting. Balanced
Right.
diet in moderation, elimination of sugar, moderate physical exercise, and a little bit of sunlight.
Interesting. I want to delve a bit more into each of those, but going back to exercise, you mentioned high intensity interval training. I'm a huge fan of that. But if you had to choose, I guess, between like long distance cardio, right? And I should ask this, Dr. Nathan, because I recently have gotten more into long distance running, which I previously was not. I have it on my list to complete a half marathon, not going to do a full one. But with that, I guess for long distance runners, like what does that look like from a nitric oxide perspective? Is that not a good thing to do, or like how does that fare, I guess, with more like resistance training or strength training?
Well, it's individualized because you have to understand when you're doing these ultra marathons and these prolonged, hour long events, what we're doing is we're diverting blood flow away from the internal organs. We're diverting blood flow away from the kidneys. And you'll notice when you're doing marathons of things, you're not making any urine. The reason for that is because the body has a way of regulating blood flow to the heart, to the skeletal muscles, to maintain the metabolic activity of that. And the sacrifice for that are your internal organs. You can develop, large intestine or small intestinal ischemia. You can develop chronic kidney disease or at least acute kidney injury from that lack of blood flow to the kidneys. So well-trained athletes are adaptive and their body can regulate that. But it's not advisable to someone who's not well-trained to go out and do a marathon or a half marathon without training up to that.
Right.
Because there has to be an adaptive effect of that, an adaptive response to where you're not shutting off blood flow and causing end organ damage. But,
Right.
I've done the half marathons, I've done the 10Ks, I've never done a full marathon just because it's just, it's time consuming. But, for me and for a lot of people who are busy, they don't take time to do, 20, 30 minutes, an hour of exercise a day, whether it's cardio or weight training. And I think that's where the benefits of high intensity or interval training come in, because you don't have the excuse of you don't have enough time. Everybody has 3 to 5 minutes. And I start my day every morning. I get out of bed and I do 100 push-ups and I do 100 squats. And it's increasing my heart rate. It's increasing my breath rate. It's taxing, but it takes me less than 4 minutes.
Right.
But and you can't use an excuse. Everybody has 4 minutes. And I know people who brush their teeth for 2 minutes. And while they're brushing their teeth, they're doing squats for 2 minutes. So it's multitasking at its best. So
I love that. Habit stacking.
Time is not an excuse anymore.
No, I couldn't agree more. You mentioned breathing. Is there a particular breathing technique? Like obviously we've hear about diaphragmatic breathing. Is there a particular breathing technique that we should exercise on a daily basis to help boost nitric oxide production?
Yeah, it's very simple. It's just breathing through your nose, because the highest concentration of nitric oxide synthase enzymes are found in the nasal epithelium, in the upper airways. So when we do nasal breathing, there's mechanoreceptors on these epithelial cells that become activated. And as long as the enzyme is coupled and functional, it produces nitric oxide. And so we all know the benefits of deep breathing and nasal breathing. It lowers blood pressure. It activates the parasympathetic nervous system. It's relaxing. And why is that? It's because we're producing nitric oxide. We're dilating the bronchioles, so we're getting better oxygen exchange. We're dilating the pulmonary arteries, so we're improving oxygen uptake and oxygen delivery to every cell in the body. And so the mouth breathers are completely bypassing this. And it's leading to oral dysbiosis. It acidifies the saliva, and they become nitric oxide deficient. They're hypoxic, and it leads to chronic health issues. So mouth taping at night for those mouth breathers, I think, is a very...
I was just going to ask you that.
As long as they don't have some obstructive sleep apnea. I mean, because if they're obstructive and they're taping their mouth, it's your body's going to try to figure out a way to get air. But if it's an anatomical issue, I recommend, go see an airway specialist in dental medicine who can look at the oral cavity, who can look at the airways and correct it, maybe through appliances or some procedures. But we have to just do nasal breathing. And it's, I like this 10 deep breaths, 5 seconds in, 5 seconds hold it, 5 seconds out. Do that 10 times. I do that in the morning when I sit in my infrared sauna. So I'm at 170 degrees for 30 minutes. And during that time, I'm doing these deep breathing and fully oxygenating. And that's how I start my day.
Yeah, I have yet to explore mouth taping. I want my dad to, although he recently shared with me he has some sleep apnea. And funny you mentioned medical appliance, because that's what he's actually going to start to use in the next few weeks. So we'll see how that fares. Yeah, no, you do. You mentioned sauna. Can sauna improve nitric oxide production?
It does. Sauna has so many benefits. I mean, one, it's just a way to detoxify.
Right.
Because we live in a toxic environment. Toxins build up inside our body, and the main routes of detoxification are breathing, deep breathing.
Right.
It's sweating, it's urination, and it's defecation. So if we're not breathing right, and we're not sweating, and we're not drinking enough good, clean water to fully hydrate and urinate, and we don't have normal bowel movements, then we get a buildup of toxins. So saunas obviously heat us up, help mobilize fat-soluble toxins, and excrete them. But if I use an infrared sauna, an infrared light, those particular frequencies can stimulate nitric oxide release. So you're getting
So
dual
interesting.
benefit in the nitric oxide release. You're detoxifying. When you release nitric oxide, you're dilating the blood vessels and you're enhancing the
Right.
detoxification and excretion.
So interesting. Yeah. Huge fan of saunas. You mentioned clean water. You are a wealth of information, Dr. Nathan. So I'm really curious. What are your thoughts, or perhaps like, what is the best, in your opinion, water filter out there? Because there are so many. I myself have tried, many different ones. We hear about reverse osmosis, so many different types of technologies. But in your opinion, what is the best one?
Well, you've got to get water that's full of minerals that are naturally occurring in the earth, right? But that's free of any toxins, drug metabolites, fluoride. Municipal water in most municipalities is probably the worst thing you can drink. And more than that, we're bathing in it, we're cooking our food in it, we're drinking it. There's, drug metabolites in there, there's fluoride in there, and it's awful. So I use a home filtration system, and I've investigated a lot of these. And the best one, I have no financial interest in this, but a company out of Florida called pH Prescriptions. And I think what's happening is they've got a filtration system that's completely removing, things like chlorine, chloramine, fluoride, drug metabolites, all these small molecules that are really hard to filter out. They've got a system that filters it out. But then in the second part of that system, they remineralize with things that natural minerals that are found naturally in water. So reverse osmosis, you know, drinking pure reverse osmosis water can deplete your body, pull minerals out of your bone. So I'm not a big
Right.
fan of the distilled water because if you drink too much of it, it'll leach all these minerals out of your bones. But it has to be isosmotic, which means it's providing the body with minerals, not pulling minerals out of the body.
Right. Do you supplement with electrolytes?
I do. In fact, one of our products that we make, the fermented beet powder, we put electrolytes in it because we find that most Americans have cellular dehydration because they're not getting the right nutrients from their food. They're drinking water that's maybe pulling nutrients out, and so electrolytes are very important. So yeah, I take electrolytes, and periodically I do micronutrient analysis to make sure that my body's replete in the basic micronutrients that it needs for the cell to do its job.
Interesting. Going back to food, so I know there's really no such thing as like nitric oxide foods, but there are foods that are known to boost nitric oxide in the body. You mentioned some before, like green leafy vegetables. What are your top three?
So what I look at from a perspective is how do I stimulate the natural production of nitric oxide? And so we have to consider both pathways. How do we stimulate and activate nitric oxide production in the lining of the blood vessels in the nasal epithelium? And so we need magnesium. So I supplement with magnesium because we know that 75% of Americans are deficient in magnesium. I think there's like 800 biochemical reactions where magnesium is a cofactor. So magnesium is simple, and we're not getting it from the foods we eat because it's depleted in the soil. So we almost have to supplement with it. The other is a good source of protein, because we break down proteins into amino acids. We utilize those amino acids to make neurotransmitters and to do a lot of things. And then the other is green leafy vegetables. That's high in inorganic nitrate that the bacteria in the mouth metabolize into nitrite and nitric oxide. So, but the most important thing is the elimination of sugar and carbs that disrupt the microbiome, that shut down the enzymatic production of nitric oxide. Sugar's the enemy, sugar's the toxin, and we got to eliminate it.
Yeah, that all makes sense. You mentioned magnesium as a supplement. I've also read that, is it L-arginine, is that how you pronounce it,
Right.
has also been shown to increase nitric oxide. Is there much research around that?
Yeah, in fact, that's how the nitric oxide pathway was first discovered, that enzyme converts arginine into nitric oxide. But we're
Interesting.
never deficient in L-arginine because L-arginine is what's considered a semi-essential amino acid. And what that means is that we get arginine from the breakdown of proteins. It comes from plant proteins and animal proteins. But we also the cell makes arginine through the urea cycle. So every cell in the body has what's called the partial urea cycle, where it makes and produces its own L-arginine. So we're never deficient in L-arginine. And as a result, we're never needing to supplement arginine because we're never deficient in arginine. So all of those, in fact, giving arginine to a patient with endothelial dysfunction can actually cause more harm than good. Clinical data published that post-infarct patients, you give them arginine and higher mortality. Patients with peripheral artery disease, they get worse when they take
Wow.
arginine. So I don't recommend
Interesting.
arginine. Any product that has arginine in it, I typically avoid and tell patients and consumers to avoid it. You don't need it.
Right. I am curious, Dr. Nathan, which supplements do you yourself take on a daily basis in addition to magnesium?
I take magnesium at night before I go to bed. Um, and so that's kind of my go-to because it's relaxing. It gives me, and I take my nitric oxide lozenge before I go to bed. So it stimulates nitric oxide production so I can fully oxygenate when I sleep.
What is that made with?
It's a nitric oxide releasing lozenge. So I developed a technology that if your body can't make nitric oxide, then we do it for you. So you put it in your
Oh,
mouth, it slowly dissolves over 5 to 6 minutes, and it's releasing therapeutic amounts of nitric oxide. It's dilating blood vessels, improving blood oxygen saturation, and mobilizes stem cells. So when I sleep, I want to repair the dysfunctional cells, and I want to mobilize my own stem cells so I can repair and replace dysfunctional cells. That's one of the main benefits of sleep. But that only happens if your body can make nitric oxide to mobilize stem cells to repair while you sleep. And then when I wake up in the morning, I do a 16, 18-hour fast every day. So I wake up in the morning, I take an amino acid because I don't want I don't want my muscle and bone to break down during that fast. Um, what else do I take? I take an algae product, spirulina and chlorella,
yep.
kind of nutrients from the sea. And then I take um, organ meat capsules from a company called Wild Mamas. It's wild, organic, raised, pasture raised bison organs.
Interesting. I use ancestral supplements, but I haven't yet heard of that one. I have to check them
Yeah,
out.
no, those are good. I think I don't personally like to eat organ meat, so I just these
Right.
companies do a really good job of creating really good high quality organ meat capsules that I consume, and then I take salmon roe from the same company. So I try to get the best nutrient dense foods from the sea, the salmon roe, the chlorella, and the spirulina, and then
Right.
from the land, the wild bison organ meats, and that gives you all the kind of basic micronutrients and macronutrients you need to start the day.
Interesting. Has there been any research around animal protein versus plant protein when it comes to, I guess, looking at it from like how to optimize a nitric oxide lens?
I'm not a big fan of all these extreme diets. I think there's benefits to a straight vegan diet and vegetarian diet, especially have advanced coronary artery disease. The data on reversing disease from a plant-based diet is pretty convincing. Um, I'm more of a kind of a carnivore. I'm not straight keto. I'll eat some salads and meat in moderation. Um, but no, whatever the source of the protein is, you have to have sufficient stomach acid production to break that protein down into amino acids. Because
Right.
humans are not designed to incorporate plant proteins or animal proteins into human proteins, right? It's a foreign protein, and our body would make antibodies against it. So the way the
Right.
GI system works is we have to make stomach acid to break down those animal proteins or plant proteins into amino acids. And then the human body, the cells, take in those amino acids, and then we make human proteins out of those. So inhibiting stomach acid production leads to a lack of digestion of proteins. Then what happens is you get peptide fragments transported across the gut. Now you develop antibodies against those and develop foodborne allergies. It all goes back to antacids.
Right. For someone who's been on an acid and antacid, I had a friend who took Prilosec for like probably over a decade, Dr. Nathan. I
Yes.
mean, aside from like, having probiotics and, fermented foods and changing their diet, what else could they do to help, like, I guess, remediate the damage that was done from the Prilosec? Like, could digestive enzymes help restore stomach acid? Again, I don't know too much how that works, but
Now
how do you like restore your integrity there?
well, you have to support stomach acid production. So the pyloric cells, the cells that line the stomach that create hydrochloric acid to acidify the lumen of the stomach, it's a biochemical reaction. So you have to understand the biochemistry. So for this biochemistry to occur, you need iodine, you need B
Mm-hmm.
vitamins, you need sodium bicarb, you need sodium chloride to make this chemical reaction go. And so if you can't make stomach acid, you can't absorb iodine, you can't absorb B vitamins, and you lost the ability to secrete stomach acid production. So you have to supplement. Number one, you have to wean off the antacids. And you can't just stop these drugs cold turkey. You've got to wean off of them over 10 to 20 days. And so I tell people, whatever dose you're taking now, take half that dose and take that half dose for 10 days. Then after 10 days, take that half dose every other day. And then after 10 days, you can stop. So you slowly have to get these drugs out of your system. But during that time, you obviously have to take my nitric oxide lozenge because that's the only source of nitric oxide you're getting. And then supplement with things like iodine, betaine hydrochloride, B vitamins, the things you need for your body to produce stomach acid on its own. And then before a meal, take apple cider vinegar, a teaspoon or tablespoon of apple cider vinegar, and that'll acidify the lumen. And now you can get better digestion, eliminate the reflux you had in the first place because your body's not trying to get rid of or expectorate the undigested food stuff.
So interesting. Wow. So much here. One other thing too, Dr. Nathan, I wanted to cover. I looked at the clock. I was like, how have we been talking already for 40 minutes? But there's so much to cover. When we first kicked off this conversation, you mentioned, how nitric oxide plays a critical role in like the development of a lot of chronic disease. One of which is, Alzheimer's and dementia. So I'd love if you could explain the connection there, right, between nitric oxide and the development of dementia, because that's certainly, sadly a disease that many, many folks suffer from. And if there is anything that we could be doing now, to help prevent that, or even for folks who already have an onset of it, just from, an optimizing nitric oxide level, that would be incredibly beneficial.
Yeah. Well, it's the most feared disease today. And as the baby boomers get older, it's the numbers are staggering. But yeah, so what is Alzheimer's? It's the end result of what we call vascular dementia. So there's a progression of disease that terminates with Alzheimer's. We first call it mild cognitive impairment. And then that develops into vascular dementia. And it's called vascular dementia because the etiology of the dementia is a lack of regulation of blood flow to the brain. And so through non-invasive imaging, SPECT scans, which look at how well perfused the brain is, or functional MRI, the metabolic activity, we can see that in any patient, from mild cognitive impairment to vascular dementia, there's a decrease in blood flow to certain regions of the brain. So if you're not getting adequate oxygenation and nutrients to those cells can't do their job. So what do? They develop insulin resistance. You can't get glucose into the cells, and the brain primarily uses glucose as its primary energy source. So we get tau tangles, we get amyloid plaque, we get inflammation, neuroinflammation. Mitochondria become uncoupled, and we're producing a lot of superoxide and hydroxyl radicals, oxidative stress. We develop immune dysfunction, and we develop antibodies against these misfolded proteins. And what is that? Well, it's lack of blood flow, it's insulin resistance, inflammation, oxidative stress, and immune dysfunction. And that describes Alzheimer's. So if we can prevent this decline in nitric oxide production or give nitric oxide-based therapies, we dilate the blood vessels, we can start oxygenating the tissue, we can enhance insulin signaling and insulin sensitivity. So now we can get glucose into the cell. The cell can do its job. We recouple the mitochondria, so we're no longer producing oxidative stress. You get the good stuff in, you take out the metabolic waste product, you eliminate tau tangles, you eliminate beta amyloid plaque, and you completely address the root cause of Alzheimer's. So we've got my company, Bryan Therapeutics, where we're developing Alzheimer's-based nitric oxide therapies. And as we move these through clinical trials through the FDA, I'm pretty convinced that the nitric oxide therapy will completely eradicate Alzheimer's in the next 10, 15 years.
That's fascinating. Are you exploring any research with cancer?
There's so many other things that we can address and have an impact on public health before we do. Cancer, there's so many confounding factors.
Right.
It depends on the type of cancer. And, cancer is a metabolic disease. So I think if we do our job in developing safe and effective nitric oxide therapies, we can certainly address the metabolic aspect of cancer. So I think maybe indirectly we'll have a positive impact on cancer. But to answer your question, no, we're not developing anti-cancer therapies. What we do what we know. I understand vascular biology. I understand normal human metabolism, how the human body makes nitric oxide, what goes wrong in people that can't make it, and we know how to correct that. And I think we
Right.
can address things like ischemic heart disease, Alzheimer's, topical drugs for diabetic ulcers, non-healing wounds, things like pulmonary
Wow.
hypertension, congestive heart failure. That,
Congestive heart failure. I was going to ask you that.
yeah,
Yeah.
no, that will give us enough runway, and that'll keep us busy for many, many
Wow.
years.
That's fascinating. What research, Dr. Nathan, has there been that have shown or that has shown rather, that like nitric oxide declines as we age? I mean, has that does that always have to be the case? We touched on, again, so many wonderful lifestyle strategies that folks can implement today, but I mean, just aging itself, is that an, contributing factor to a decrease in nitric oxide?
Yeah, aging is the number one predictor of loss of nitric oxide, or the number one risk factor for loss of nitric oxide.
There you go.
But now that we understand how the human body makes nitric oxide, we can actually prevent that age-related decline. And in some cases, we can actually accelerate it. We're seeing 20, 25-year-old kids that have the nitric oxide production of what a normal 60 to 70-year-old would have.
Why is that?
Well, it's these kids that are eating processed foods and they're couch
Right.
potatoes. They're not getting exercise and they're living the Western life and they're metabolically challenged. And so then on the other side of the coin is, I'm 51 years old, but I've got the vascular age of a 30-something-year-old. So we know that we can shift this to the left or the right depending upon what we put in our body, what we do, the decisions we make, and how much discipline we have. And
Right.
I just want to make sure that I can live the best quality of life that I can as long as I can. I mean, we're not immortal. Everybody dies at some point, but
Right.
I want to live a healthy life as long as I can to leave a lasting impact.
No, I love that. I couldn't agree more. Yeah, I had a conversation the other day with a friend, and I'm Christian, Dr. Nathan. And one thing that I've come to realize, and I don't know if you know this, my mom was diagnosed with stage 4 breast cancer back in 2018. She's the reason why I started WellnStrong. So I'm super passionate about integrative medicine. That's been the key cornerstone content of WellnStrong. But over the years, especially this past year, I've kind of developed a new perspective on all things health, in the sense of, I think in this age of biohacking and longevity and trying to extend our lifespans, we get so caught up in doing all these things that are thrown at us. But I think in the grand scheme of life, we are to be stewards of our bodies, right? We are to do what we can do. But at the end of the day, we have to recognize that all of our days have already been written, right, in God's
That's right.
book. And there is nothing that we ourselves can do to extend the days that He has given us. And that has brought a lot of comfort and peace to me, again, in a space, and you're in the space as well, where there's this constant influx of do this to, live an extra 20 years, but we're not in control of that, right? So I think just having that different perspective and how we approach the things that we do for our health alleviates a lot of anxiety. And even in just, the treatments that my mom has done and, the journey we've had over the past 6 years, it's brought a lot of comfort. So that's kind of been
No, I
my
agree. Look, we can
insight.
learn a lot through science, but I think it's having conversations with our Creator that really lead us to the insight, because
Yeah,
we're divinely created, and God doesn't make mistakes. There's a lot of things that happen
absolutely.
that we don't understand, but we trust and have faith that it's it all happens for a
Yeah,
reason, and it's not what happens to us that matters. It's how we react to what happens to us that matters. You
yeah.
got to have faith.
Amen.
Keep moving forward.
100%. And I think that, and I'm sure you've experienced this too, just in your career, but the more I learn, and my background is in economics and finance, so completely unrelated to all integrative medicine, but I call myself a researcher at heart. When people ask, what is your background? I'm like, I'm a researcher. But the more that I learn, from my own research, the more conversations like these that I have, the more I see God's hand in everything. It's wild, just how little we really know, right? Our bodies, how they work, we're truly miracles. We're walking miracles.
Absolutely. Now, when I look at how resilient the human body is, I mean, the abuse that some people do to their body and the life they live, and the fact that their body still
Yeah,
performs and they're alive and they're doing going,
right?
wow, but
It's wild.
it's amazing. The human body is an amazing creation, and we got to take care of it and honor it.
Yeah, no, absolutely. Well, Dr. Nathan, this has been one of my favorite conversations to date. I think you are wonderful. I'm a big fan of your work. I'm really excited to share this episode. But with that, where can listeners find you and learn more about all of the wonderful things that you are doing?
I try to create education and content. I got a YouTube channel, Dr. Nathan S. Bryan, Nitric Oxide. Um, we have information out there. My number one objective is just to educate and inform on nitric oxide so we can empower patients and consumers to take control of their own health and get a little bit of information on nitric oxide. I've got an educational website, Dr. Nathan S. Bryan. I'm on social media, Instagram, Dr. Nathan S. Bryan, LinkedIn, Twitter. I'm at Dr. Nitric. And then I've got a new book coming out February 24th. It's called
Very
The Secret of
exciting.
Nitric Oxide, Bringing the Science to Life.
Oh my goodness.
I will.
Congratulations.
But this chronicles kind of my 25 years in science. It's part autobiographical. We talk
Wow.
about the discovery of nitric oxide, what it is, what it
Love
does.
that.
So February 24th is the official launch. I'll be on 34 morning shows doing live interviews talking about the book and the science of nitric.
That's incredible. Wow. Well, I am so excited that I had you on today. Prior to that, I will be picking up a copy of your book, certainly. I will be linking all of that in the show notes. So that's, wow, very, very exciting. Congratulations.
I'm excited. Thank you.
My last question for you, Dr. Nathan, this is always my favorite one to ask,
Okay.
and that is, what does being well and strong mean to you?
And it allows me to do what, I wake up every day with a servant's heart and try to figure out how to, I think our time on here is we're serving others. And if we don't have our health, we're compromising our ability to do our daily job. But for me, it's doing the things I want to do, not doing the things that I have to do with the people that I want to do it with. And, that's for me, it's waking up every morning with a purpose in living out our mission of service.
Love that. Beautiful. Well, you're certainly doing that. Again, kudos to you for all the wonderful work you've done. So excited to share this. And yeah, I hope to have you on again at some point soon. There's so much to discuss.
Let's do it. Yeah, it's 45 minutes isn't a lot of time to discuss nitric oxide science.
Thank you, Dr. Nathan.
Thank you.